This is lecture 6 of 6 lectures on renal disorders. This lecture is on acute kidney injury. By the end of this lecture, you should be able to answer these questions. What's the difference between acute kidney injury and chronic kidney disease? What are the 3 types of acute kidney injury and the nursing considerations for such? Here are some of the difference between acute and chronic kidney disease. Acute kidney injury is most common in the acute care setting, whereas chronic kidney disease is more likely to be seen in community settings or as a coexisting condition in acute care settings. The onset of acute kidney injury is sudden, in a matter of hours to days. The onset of chronic kidney disease is gradual, in a matter of months to years. The duration of acute kidney injury is between 2 to 4 weeks or less than 3 months, whereas the duration of chronic kidney disease is permanent and irreversible, and what's worse, it's progressive. Nephron damage in acute kidney injury is approximately 50%, whereas nephron damage in CKD is between 90 to 95%. The prognosis for AKI or acute kidney injury is good. Fatality may occur in some cases, but with prompt treatment, prognosis is generally good with a return of kidney function in acute kidney injury. But in chronic kidney disease, this is fatal without dialysis or without kidney transplant. The causes for acute kidney injury are categorized into 3. It's pre-renal, intrarenal, and post-renal. The causes for chronic kidney disease, as was mentioned in the previous lecture, are diabetes mellitus, hypertension, polycystic kidney disease, and glomerulonephritis. What is acute kidney failure or acute kidney injury? I have 4 sources for the definition. Acute kidney failure is the sudden cessation of renal function that occurs when blood flow to the kidneys is significantly compromised. That is true, but it's not complete. Acute kidney failure is a rapid decrease of kidney function leading to the collection of metabolic wastes in the body. Acute kidney failure is a sudden and almost complete loss of kidney function characterized by rising levels of blood urea nitrogen and serum creatinine and an inability of the kidneys to regulate fluid and electrolyte balance. This is like a more complete description of acute kidney injury. Acute kidney injury is a rapid and progressive azotemia, an accumulation of nitrogenous waste products such as urea, nitrogen, and creatinine, and progressive increase in potassium. The common denominator in all these 4 definitions or descriptions is the loss of kidney function. What are the three causes of acute renal failure? Please look or pay attention to the numbers here. There are three causes. It's pre-renal, intrarenal, or post-renal. So pre-renal is before the kidneys, intrarenal involves the kidneys, and post-renal is anything after the kidneys. With pre-renal, think perfusion reduction. With intrinsic or intrarenal, think kidney damage. With postrenal, think obstruction, specifically obstruction in the ureters, bladder, or urethra. Here, it's prerenal is the sudden and severe drop in blood pressure, shock, or interruption of blood flow to the kidneys from severe injury or illness. So, prerenal, think perfusion reduction. Intrarenal, direct damage to the kidneys by inflammation, toxins, drugs, infection, or reduced blood supply. So, intrarenal, think kidney damage. Postrenal, sudden obstruction of urine flow due to enlarged prostate, kidney stones, bladder tumor, or injury. Postrenal, think obstruction or stricture. So post-renal acute kidney injury is caused by sudden obstruction to the urine flow, such as a ureter stone, ureter stricture, which is narrowing of the ureters, bladder atony, bladder tumor, and enlarged prostate. Types of acute kidney injury and nursing implications. Nursing consideration in acute kidney injury is early recognition. That is why in your head to toe assessment, you need to ask questions with regard to voiding or peeing and characteristics of the urine. For example, in pre-renal renal injury where there's inadequate perfusion, in other words, there's not enough blood or sufficient pressure to allow filtering, you look for hypotension, dehydration. You ask when the last time the patient peed, and you look at urine output. With intrinsic or intrarenal acute kidney injury, there's damage to the cells that make the filtering mechanism inefficient or damaged. So you look at nephrotoxic drugs such as NSAIDs, contrast dye, and antibiotics. You look at glomerulopathies such as glomerulonephritis. With postrenal, there's obstruction. Urine is unable to drain adequately. So you will assess for difficulty initiating urine, dribbling urine. In other words, the urine stream is not good, and you assess for full bladder. And other assessment questions in regard to CKD, you should ask, did you notice anything unusual? If the client says yes, urine was frothy, you suspect proteins leaking. Yes, it was dark, you suspect dehydration or kidney failure to some degree. Yes, it was funky smelling, which might mean or indicate UTI or urinary tract infection. Yes, there was dribbling, which could mean obstruction in the somewhere in the urinary tract. And yes, I had trouble starting urine, which could mean anatonic or neurogenic bladder. Anatonic neurogenic bladder simply means that there's no muscle tone. The bladder is flaccid. Or the client might say, yes, there was some specks of blood, which could mean any number of things. That's the end. This ends lecture number 6 of lectures on renal disorders. Thank you.